हेलो गुड मॉर्निंग, मैं से डॉक्टर आर्यन और आज हम डिस्कस करेंगे मेडिसिन के कार्डियोलॉजी सेक्शन के सम इम्पोर्टेंट एमसीक्यू बेस्ड ऑन द फाइंडिंग ऑफ इज बंडल इलेक्ट्रोकार्डियोग्राम. इफ द AH interval is prolonged, the block is most likely located at the below the bundle branches within the AV node, in the atria, in the ventricle. Here the question says the AH interval is prolonged. Here the answer is the within the AV node, because if the AH interval, the time between the AH interval, the time between the activation of atria and the activation of his bundle, which reflects AV node conduction, and is prolonged on his bundle electrogram. It indicates that there is a delay within a AV node. This delay can lead to a various degree of AV block depending on the severity of the conduction impairment. That's why the answer is the within the AV node. Next question. A 65-year-old male with a medical history of hypertension and ischemic heart disease present on the emergency department due to intermittent fainting episodes. He described feeling dizzy and lightheaded before losing consciousness, and each episode lasts for a few seconds. His heart rate is slow with an irregular rhythm. ECG show P waves at 100 per minute and QRS complex at 30 per minute. What is the most likely diagnosis? Atrial fibrillation, Stokes-Adams syndrome, ventricular tachycardia, supraventricular tachycardia. Here the answer is the Stokes-Adams syndrome, because the Stokes-Adams syndrome is a characteristic by sudden transient episode of syncope, fainting, and due to the sudden decrease in cardiac output caused by transient arrhythmia, often complete third degree of the heart block. The symptoms described include intermittent fainting episodes, dizziness, lightheadedness, and the ECG finding of P waves at a rate of the 100 per minute with the QRS complex at 30 per minute. Aligned with this condition, the heart rate and irregular rhythm indicates a significant AV conduction problem. AV conduction problem. Next question. A 68-year-old male patient with COPD present to the emergency department with palpitation, dizziness, and shortness of breath. His heart rate is 110 beats per minute and the rhythm is irregular, and auscultation reveals multiple rapid heartbeats. The ECG show an irregular RR interval and P waves are present, but they appear with varying morphologies. What is the most likely diagnosis? Ventricular tachycardia, multifocal atrial tachycardia, atrial fibrillation, and sinus tachycardia. Here the answer is the multifocal atrial tachycardia, because the clinical scenario and ECG finding align with the features of the multifocal atrial tachycardia. MAT is a type of the atrial tachycardia characterized by irregular and rapid heartbeats originate from the multiple ectopic foci in the atria. It is the most commonly associated with underlying pulmonary disease such as COPD in the patient, cardiac disease, electrolyte abnormalities, mainly hypokalemia and hypomagnesemia, and chronic renal failure. That's why the answer is the multifocal atrial tachycardia. Next question. A 45-year-old female present on the clinic with palpitation and irregular heartbeats. On evaluation, an arrhythmia is detected and the patient is prescribed an antiarrhythmic medication. The patient returns after a few weeks with malar rash and joint pain. Which of the following drugs has a similar antiarrhythmic mechanism of action as the medication is prescribed? Amiodarone, lignocaine, flecainide, dysparannamide. Dysparannamide is the correct answer, because the drug initially prescribed to the patients is procainamide. Procainamide is an anti-arrhythmic medication used to treat various type of arrhythmias. However, after a few weeks of taking procainamide, the patient develops symptoms of malaise and joint pain, which are indicative of drug-induced lupus. Disopyramide is another class IA anti-arrhythmic medication similar to the procainamide, and has comparable mechanism of action. That's why here is the answer. Next question. Which of the following has been withdrawn due to the side effect of polymorphic ventricular tachycardia? Domperidone, Avastin, cisapromide. Here the answer is the cisapromide. Answer. Sorry, the two option is similar. Here the answer is the cisapromide. When a patient why is the cisapride? Because when a patient taking is the cisapride for acid reflux disease, there is already a potential risk of QT prolongation and development of polymorphic ventricular tachycardia. It also interacts with the commonly prescribed macrolide erythromycin used for the treatment of community acquired pneumonia. It can inhibit community acquired pneumonia. What's inhibit? Is inhibit a CYP3A4 enzyme. CYP3A4 enzyme is inhibited in the where is inhibited in the liver. This inhibition can slow down the metabolism of the cisapride, causing high levels of cisapride for trigger arrhythmias, and the increased level of the cisapride in the bloodstream combined with its inherent propensity and to prolong the QT interval can significantly raise the risk of the developing a life-threatening arrhythmias like pulseless ventricular tachycardia or torsades de pointes. Next question. A child with a congenital heart disease is on digoxin. He develops prostration and is given IV lignocaine. Here the main point, prostration. In the emergency department, which rhythm disorder would have development in this child? Atrial fibrillation, paroxysmal supraventricular tachycardia, ventricular bigamy, and premature ventricular contraction. Here the answer is the ventricular bigamy, because the lidocaine is a local anesthetic of the amino-amide type, and it is a drug of choice for the treatment of digoxin-induced ventricular bigamy. It reduces the enhanced automaticity of a subsidiary pacemaker and AV nodal conduction in therapeutic concentration. That's why the answer is the ventricular bigamy. That's all. Thank you and keep revising.